This is Dr. Chandana, Director and Fertility Consultant, Aaroos Fertility, Karimnagar. Today I am going to talk about in vitro fertilization, which is also called test tube baby. So Louis Brown was the first test tube baby who was born in July in 1978. So today I am going to tell you about the steps in the IVF procedure. So IVF procedure, by definition, it is fertilization of egg with sperms outside the body and embryo is formed, which is again back transplanted into the uterus, deposited into the uterus. So it includes 6 steps. So first step comes counseling, which is very important step for IVF patients because they are already physically, emotionally and mentally drained off. So we have to counsel them in all the sense, and also financial counseling should be given to them, and decision they have to finalize. And then comes ovarian stimulation. Ovarian stimulation means to ovaries we will stimulate the ovaries by giving some gonadotropins and fertility drugs, so we can get multiple eggs for the pickup. Then comes the step called pickup. During ovarian stimulation, we will be doing continuous monitoring and also some scans, and according to that doses are adjusted, so it is absolutely safe. And then comes the ovarian pickup, for which patient is admitted in the hospital and it is done under short anesthesia. So in this procedure, we will pass a needle through the vagina under transvaginal ultrasound guidance, and with that needle we will suck all the oocytes from the ovary. So then husband gives his semen, and that semen will be used either fresh or frozen, or in some cases we might have to extract the sperms with a procedure called TISA, and then fertilization is done. So fertilization can be done directly or through a procedure called ICSI, in which a single good high quality sperm is picked up and then it is injected into the egg. So then happens the fertilization procedure. Then after the fertilization procedure, specifically on day 3 and day 5, the embryos will be monitored. So then comes the embryo transfer procedure, for which the endometrium is prepared with some medications, and then after we get a certain thick endometrium with a good blood supply, we will deposit the formed embryo back into the uterus. So this is called embryo transfer procedure. And after that comes post-transfer care, which is also very, very important. So in this post-transfer care, we will support the embryo, and we will with some hormones and some medications, so that embryo will be deposited well in the uterus and the pregnancy will happen. So after 2 weeks of embryo transfer, we will give a date for beta HCG, which then shows whether the patient is pregnant or not. Thank you.